Okay, guys, so in this video, we'll talk about a complicated topic which is frequently tested in INI-CET exam, that is thromboelastography. So just try to understand this. What is a thromboelastography? It is nothing I can say. It is a test to measure shear elasticity. And what else we can check? We can check dynamics of how a clot is being formed, means and dynamics of clot. Now understand, basically this is a test where we can check how efficient our blood clotting system is working. So basically this question came once in exam. It is a test to check efficiency of blood coagulation. It is a test to check efficiency of blood coagulation. So in recent few years, there are question as an exam based on like a thromboelastogram. So just try to understand this. This is used in various departments. So wherever we are having hypercoagulable or hypocoagulable state. So in medicine, surgery, anesthesia, in gynecology, in labor room, everywhere we have a role. Even in cardiothoracic vascular surgery, we have significance of thromboelastogram. Now, just try to understand this. The benefit of doing thromboelastogram, when I'm writing in short TEG, is from this we can check each phase. Each phase of our clotting process can be checked. Now understand? Like for example, if we have PT and INR for our extrinsic pathway, we have APTT for our intrinsic pathway, then we have a BT, CT. But they are particular for a particular fragment of clotting cascade or platelet. For example, but this thromboelastogram here, you can check each phase, means like from aggregation to, I can say, fibrinolysis. Each of these phase can be checked. Now, how we do this test? So understand, the graphical image we create, and that graphical image is what we call this thromboelastogram. So what is thromboelastogram? It is a graphical image of recorded amplitude of movement of pin as a function of time. So how to do this process? That sometimes they ask in exam. So understand. So before moving to this, we have primary and secondary hemostasis. Understand, this primary hemostasis is done by platelets. And a purpose of this hemostasis is to make a weak platelet plug. There is formation of weak platelet plug. This weak platelet plug is further stabilized by secondary hemostasis, and that secondary hemostasis is done by clotting factor. So this weak platelet plug is stabilized by secondary hemostasis. So understand this. For example, you get a simple bleeding. There is vasoconstriction followed by platelet adhesion. There will be degranulation of platelet. Ultimately, many platelets will aggregate. So there will be interaction of like a GP1B, GP2B, 3A. So we get a weak platelet plug. So that weak platelet plug will have a chance of rupture. So that is why it is stabilized. The strengthening is provided by clotting factors. That is called secondary hemostasis. So when I talk about primary hemostasis, just most of you are knowing this, so just try to understand this. Suppose there is a bleeding. Initially, what you will notice there will be vasoconstriction. Then in the endothelium, we have a hidden body. These hidden bodies are called Weber-Pollard bodies. Weber-Pollard bodies. These Weber-Pollard bodies, what they will do, they will release von Willebrand factor. So von Willebrand factor, like this is acting like a transporter for clotting factor number 8. And second thing is like this von Willebrand factor is important for Adam TS13. That is means like this should be chopped into pieces. Only then it can support your platelet adhesion. After only this, you can see platelets. Suppose this is platelets. So these platelets can be stick to the endothelium. And this sticking is mediated by a protein. That protein is called GP1B. Ultimately, you can see degranulation of platelet. So degranulation means this will release ADP. and thromboxylated. But one platelet is not sufficient. We need multiple platelet. So multiple platelet, they join together, and it is with the help of a protein that is called GP2B3A. GP2B3A. Here we also need fibrin to provide some stability. I think most of you are knowing this, so just I am telling you to recall all this. What we have adhesion, then we have degranulation, and third what we have platelet aggregation. So this is how a weak platelet plug is formed. Ultimately there will be action of clotting cascade. Then with the clotting cascade, this weak platelet plug with clotting factors, this will make a complete plug, and this is how your bleeding is stopped. So we have different component of a thrombus formation. So first I can say there is platelet aggregation. I can say here you can see vasoconstriction. Then what we have platelet adhesion. Then you can see there is degranulation, and ultimately the last is aggregation. So last component of this primary hemostasis is aggregation. So you can see there is platelet aggregation. This platelet aggregation means platelets, they aggregate, they will form a primary plug, a weak platelet plug, and this plug is vulnerable to rupture. ये आगे जाके rupture कर सकता है. So then this platelet aggregation will ultimately, it will stabilize by clotting factor. उसको हम बोलते हैं clot strengthening. There is clot strengthening, and this clot strengthening means there will be interaction of fibrin with platelet. So fibrin will basically reinforce a platelet. So it is due to fibrin and platelet. Then what we can see, we can notice like there will be like a fibrin cross-linking. There is fibrin cross-linking, and ultimately this is how a thrombus is formed. Now, if you want to separate this thrombus, there can be fibrinolysis. So these are basically steps of thrombus formation. So what you have to remember, like what is this technique, how we perform this technique. So just try to understand this. In this technique, what we are taking, like an oscillatory cup with whole blood, and we heat this at a 37 degree. Now you can see there is an oscillatory cup, so this will be rotating at an angle of 4 to 45 degree. And try to understand this. In this, what we do, we attach a torsion wire. So this pin with the torsion wire is attached, and ultimately with this you can see, you can notice that this cup will oscillate around this torsion pin, and you can see there is formation of clot. This clot will form, and this will adhere to the pin, and I can say through electromechanical transducer we have attached this. What we can get a reading, right? And that is we can illustrate that graphical reading in the form of a graph, and that is what we call thromboelastogram. So this is how you can see this transducer, or this I can say a torsion wire we will attach. Then this will be connected to the this will provide electrical signals to a computer. With this we will get a graphical illustration, that is called a thromboelastogram. Now they ask you some basic question like how to study this. So for this we have certain important component, like we have R time, we have K time, we have this angle, what we call this alpha angle. Then what we have like a maximal amplitude and Ly30. These are basic 5 components. So these 5 components you have to remember. So first thing is this component you have to remember in a sequence. So first is R time. R time. Second is called K time. Third will be alpha angle. Alpha angle. Fourth will be maximal amplitude. And fifth will be lysis 30. We also call this Ly30. Now, what is the meaning of this R time? Understand, this R time is nothing. This is a time to initial clot formation. So this is nothing. It is time to initial clot formation. This time is called R time, or we call reaction time. तो पहले तो आपको ये सीक्वेंस समझना है. So the sequence, how we can remember? So we can remember by a mnemonic, that is Rajnikant, alpha male, alpha male. Rajnikant is alpha male. K is called K time, or I can say this is a time from, I can say from initial clot to initial clot bana until that clot will reach to a certain level of firmness. Initial clot to reaching 20 mm of firmness, or of 20 mm of amplitude. So basically this is telling you about firmness. मीन्स एक पर्टिकुलर लेवल की फर्मनेस और स्ट्रेंथ उस क्लॉट में आ जाती है, उसको बोलते हैं के टाइम. देन वी हैव अल्फा एंगल. दिस अल्फा एंगल इज टेलिंग यू इंफॉर्मेशन ऑफ क्लॉट काइनेटिक्स. Clot kinetics. So what I mean by clot kinetics, understand this is nothing, it's an angle. So angle between the baseline of the initial clot, right? And we have a tangent line. Then we have maximal amplitude, means it is like maximum deviation of tracing. So this is what we can say, it is like in the range of 55 to 73. And LY33, this will be amplitude. So maximum amplitude is maximum deviation of tracing. So whatever you are seeing in graph, that maximum level of tracing is maximum amplitude, and LY33 is amplitude 30 minutes after maximum amplitude. So these are basically some time. So that is these readings, if you know these values, then, but the more important is they ask you a question on graphs. So let us see this one by one. So just try to understand this. So first time, what I am telling you is reaction time. So this time is reaction time. If I just want to make a shading with this, so this time means time for initial clot formation. This time is what we call R time. This is R, right? Then I told you like a particular level of firmness is seen. So this is what we call, this particular level of firmness is achieved. That is something what we call this, or I can say this duration. This duration is called K time. Then if you notice, they will make an angle, and the angle which we see here, this angle is normally in the range of 47 to 74 degree. This angle is what we call alpha angle. So what this angle is telling you, it is telling you kinetics of clot, and ultimately you can notice like a maximal height. So this is the maximal height which I am shading. This maximal height, इसको बोलते हैं maximal amplitude or maximum deviation of tracing. Then you will notice जो clot बना, now that clot will start lysing. तो जो tail जो जा रही है, this you can notice from here onwards, it start regressing. This tail is called LY30. Means it is seen 30 minutes after maximal amplitude. So this is this clear? So let me change the pen so that I can show you all the readings. This is R time. This is K time. This is the angle. Then what we have, this is MA, and here what we see, this downfall, ये जो tail जा रही है, पूंछ से जा रही है, that downfall is what we call lysis 30. So each of these reading have a particular significance. So understand, maximum amplitude or maximum strength of clot is your MA. So MA basically what it's telling you, it is telling you like interaction of a fibrin and platelet. So more and more fibrin. So this is like maximum strength what we can get. Now coming to each of this component to understand this. So first is your reaction time. What I mean by reaction time? Reaction time means it is time elapsed till initial fibrin clot formation. So this time which is we are spending on initial clot formation, this time. So just focus one by one on each of these things. This time is called reaction time. Now try to understand. You can see like this time can be elevated. There are certain scenarios where this time will be elevated. It means clotting factors are not properly working. So this time will be elevated in clotting factor deficiency, or I can say, what else can cause this? This can occur whenever we are using a lot of anticoagulants. Means we are using warfarin, heparin, anticoagulants. Clear? So either you are having anticoagulant overdose or clotting factor deficiency, then this R time means time to initial clot formation will be prolonged. Clot nahi banega jaldi se. That time is called reaction time. It is normally 4 to 8 minutes. Then understand this. Suppose there is deficiency of clotting factor. अगर clotting factor की deficiency है और anticoagulant का overdose है, तो how we treat? We treat by FFP. सो अगर आपके पास एक थ्रोम्बोलास्टोग्राम की रीडिंग है, उसमें टाइम बढ़ा हुआ है, तो ऐसे में क्या दोगे? फ्रेश फ्रोजन प्लाज्मा. और व्हाट एल्स वी कैन यूज? वी कैन आल्सो यूज पीसीसी. पीसीसी इज प्रोथ्रोम्बिन कॉम्प्लेक्स कंसंट्रेट. So that is an alternative option to FFP. Moving to next is K time. अब इसको समझो एक बार. What is K time? K time is time. This time where a clot is attaining a particular level of firmness. That is called K time. So a certain level of firmness, एक मजबूती आ रही है क्लॉट के अंदर, उसको हम बोलते हैं K time. Now this K time, suppose if this K time is elevated, मजबूती किसकी वजह से आ रही है? फाइब्रिनोजन की वजह से आ रही है. अगर ये K time बढ़ा है, इसका मतलब मजबूती नहीं आ रही है या कम आ रही है. It means body is having less fibrinogen. So less fibrinogen we can see in a condition like A fibrinogenemia. So this is how we treat. Now understand. इसको समझो एक बार. Here we can give FFP, but FFP will have multiple clotting factors. Cryoprecipitate is more specific, or I can say ultra filtered product. इसमें क्या होता है? इसमें होता है clotting factor 8. We can have a von Willebrand factor. We can have factor 13, and we have fibrinogen. Even ये भी क्वेश्चन एग्जाम में आता है. They ask you all are component of cryoprecipitate except. So K time अगर बढ़ेगा तो if K time is prolonged, it means fibrinogen ठीक से काम नहीं कर रहा है, so clot में firmness नहीं आ रही. So what we have to give? We have to give cryoprecipitate. Normally it is 1 to 4 minutes. Then third or next thing I can say, just focus on this. Then what we have alpha angle. Alpha angle is telling you like this angle is 47, को उल्टा कर दो क्या बन जाएगा? 74. So normal value is 47, 74 degree. This is telling you like this angle. This angle is telling us like how speedily fibrin is accumulating. So again, अगर ये angle भी छोटा होगा, angle भी कम होगा, it means like fibrin is there. You can notice there is low fibrinogen. So that's why fibrin is not properly accumulating. So this is basically measuring the speed at which fibrin build up and cross linking take place. So again, fibrinogen कम है, तो यहाँ पर भी क्या दोगे? Cryoprecipitate. FFP also we can use, but better is cryoprecipitate. Clear? अगर available नहीं है, then you can use FFP. Now understand, अब ये clot maximal amplitude अपने maximal height पे पहुंच गया, तो highest vertical amplitude, this height is what we call this MA, and it is normally 55 to 73 mm. So here you will see maximum strength, means ultimate strength of fibrin clot. Now this is basically, I told you, this is basically depending on two things. Platelet. So अगर platelet, suppose platelet में कोई defect है, so it could be a qualitative defect or a quantitative defect. So it means then this maximum amplitude could not be achieved. ये उतना achieve नहीं होगा. So ऐसा कहाँ हो सकता है? It can be like in platelet disorders like ITP, TTP, Bernard-Tholier, Glanzmann syndrome. So basically it's a defect of qualitative platelet and qualitative or quantitative defect. Suppose if you see this maximal amplitude अगर ये छोटा आएगा, it means पूरी तरीके से क्लॉट नहीं बना है, अच्छा नहीं बना है. So ऐसे में आप क्या दोगे? If you see this is small, if this is low or small in height, in that case how we treat? We give platelet. Platelet के अलावा what else we can use? We can use desmopressin. Clear? Desmopressin actually what it will do? It will push Weber Pollard bodies to release more and more von Willebrand factor, so that there will be more chance of platelet adhesions. But platelet से अच्छा नहीं होगा. Again platelet will be better option. Now coming to LY30. LY30 means after 30 minutes you will notice like there is lysis. this this tail is what we call, ये जो tailing हो रही है, that tailing is called LY30. This is basically telling you information of on fibrinolysis. अगर LY30 prolonged tail लंबी जा रही है, it means, or it is prolonged, it means there is increased fibrinolysis. There is more fibrinolysis, so it can occur whenever patient is you are doing some sort of thrombolytic, like in stroke patient, or I can say in sometime MI we do thrombolysis. So if this is increased, then what we use as a treatment, we give anti-fibrinolytic drugs like tranexamic acid or aminocaproic acid. ये एक बार MCQ भी आया था, what is the antidote of thrombolytic overdose? That is aminocaproic acid. Epsilon aminocaproic acid is full name. So once you understand this thing, we have different components. So let us summarize each of this. So first is R time. R time, what I told, R time is reaction time. So it is time till initial fibrin clot formation. So normally it is 4 to 8 minutes. And if this R time, understand, अगर ये R time clotting factor का defect होगा, what about R time? You will notice this R time will be prolonged. ये बढ़ा हुआ आएगा. इसका मतलब clotting factor पूरे टाइम लगा रहे हैं क्लॉट बनाने में, राइट. K time means fibrinogen, means time elapsed till cloth reaches a particular 20 mm fixed strength. If this fibrinogen, so it is mainly because of fibrinogen. So suppose if this K time is prolonged, it means your body is not having sufficient fibrinogen. So ऐसे में क्या दोगे, क्या precipitate, इधर क्या दोगे, FFP. Now see alpha angle, it is telling you information on speed of fibrin accumulation. So if you see alpha angle here, if this angle is low, this angle will be low or less in case of fibrinogen defect. And MA is maximal amplitude. Maximal amplitude means it is normally I can say 55 to 73 mm. This is basically telling you information of whether you are having good platelets or not. So if this maximal amplitude, I can say if this maximal amplitude is less, it means your platelets are not of good quality or they are not insufficient in number. Means qualitative platelet defect. तो ये बस आपको समझना है. If you understand this thing, everything is simple. तो इसमें क्या दोगे आप, प्लेटलेट दोगे. Now they sometimes ask you like a graphical image in exam, like what I'm seeing from past 2 years, they're asking image based question. So let us first try to understand each of these image, then you'll get an idea. तो पहले मैं नॉर्मल इमेज में यहाँ पर आपको बता रहा हूँ, देन वी विल डिस्कस द पैथोलॉजिकल इमेजेस. जस्ट लुक एट द स्क्रीन फर्स्ट. व्हाट यू कैन सी दिस इज R, दिस विल बी K, देन व्हाट वी हैव पर्टिकुलर एंगल, और ये क्या हो गया, दिस इज योर MA. MA मीन्स मैक्सिमल एम्पलीट्यूड. एक बार फिर से देख लो, मैं फिर से बना रहा हूँ. यू कैन सी दिस इज रिएक्शन टाइम, दिस विल बी K टाइम, kinetic time. Then what we have here, you can see an angle. This angle is what we call, this angle is called alpha angle. और ये क्या हो गया, MA, maximal amplitude. So यहाँ पर सब कुछ normal है. So you can see normal R, you can see normal K, you can see normal angle, and you can see normal maximal amplitude. Now suppose a person who have taken anticoagulant overdose, warfarin heparin आपने ज़्यादा दे दी, या फिर किसी को clotting factor की deficiency, then what you are noticing, ये R time to initial clot formation, वो time बढ़ जाएगा, clotting factor है नहीं body में. So that is called, you can notice there is increase in R time. R time बढ़ गया, right? Then if you see R time is increased, this K time is also increased. K time is increased. Now K time is increased, R time is increased. Then if you notice, और अगर आप देखोगे ध्यान से, if you focus on this clearly, then you can notice like there is R and K both are prolonged. अगर आप देखोगे MA, maximal amplitude, ये उतना नहीं अचीव हो रहा है, so maximal amplitude will be less. Clear? Maximal amplitude will be less. And angle, let me write complete. This is alpha angle. Angle is also reduced. So आपको पूरी चीज़ें नहीं देखनी, just you need to focus on the graph. So R time बढ़ गया. Now if you compare this with this thing, in this what you can notice like R is almost normal, right? K थोड़ा सा बढ़ा हुआ है. R reaction time is normal, it means clotting factor तो है. K is a bit prolonged, K is prolonged. अब K prolonged कब हो रहा था देखो एक बार, where you can see K is prolonged, it means some defect in fibrinogen. Then you can notice like maximal amplitude कैसा हो गया, यहाँ पर कम हो गया, maximal amplitude is reduced, right? Maximal amplitude is reduced. So this is whenever a person, इसको हम क्या बोलते हैं, इसको बोलते हैं प्लेटलेट का डिफेक्ट है कोई. So either any platelet defect, so platelet defect, or I can say a person is having platelet blocker, means some drugs, anti-platelet drugs चल रहे हैं. So if you focus on this, अगर आप इसको देखोगे, then you can notice like R is almost normal. So R कैसा है, R is normal, right? But if you follow this, अगर आप देखोगे ये lysis LY30 बहुत जल्दी अचीव हो गया, मीन्स यू कैन इट्स प्रोलॉन्ग. सो इफ यू नोटिस लाइक दिस LY30 एंड मैक्सिमल एम्पलीट्यूड कम होते जा रहा है, राइट? सो MA इज कंटिन्यूसली डिक्रीजिंग एंड LY30 इज प्रोलॉन्ग. मैंने बताया था टेल लंबी सी आएगी, टेल इट मीन्स क्या हो रहा है, फाइब्रोलाइसिस हो रहा है, इट इज शोइंग यू फाइब्रोलाइसिस. तो दिस इज लेट मी से वंस अगेन, यू कैन नोटिस हियर, अगर आप देखोगे दिस इज R, सो R इज ऑलमोस्ट नॉर्मल, लेकिन मैक्सिमल एम्पलीट्यूड तुरंत कम होते चले जा रहा है. मैक्सिमल एम्पलीट्यूड इज शॉर्टन, कंटिन्यूसली डिक्रीजिंग. एंड LY30, ये जो मैं ब्लू से, लेट मी मेक इट विद डिफरेंट कलर विद द पिंक, दिस इज, यू कैन नोटिस टेल बन रही है. सो LY30, right? This is LY30. So this is what we can see thrombolysis or fibrinolytic. Then suppose in this what you can notice, R थोड़ा जल्दी आ गया, इसका मतलब बहुत सारे clotting factor हैं, right? If you see K is also decreased, it means R and K both are decreased, right? If you notice like MA is achieved early or MA is increased, angle भी बढ़ा हुआ है, so MA and angle are increased. So this is what we call hypercoagulable state, means body में बहुत सारे clotting factor हैं. Now last is DIC. So DIC में basically like there are two stages. So initially what we get stage 1. Stage 1 is more often hypercoagulable state. More often hypercoagulable state. In stage 1 you will notice like let me write it here, hypercoagulable state होती है stage 1. And stage 2 is something called hypocoagulable state. So अगर आप देखोगे like stage 1 is hypercoagulable, stage 2 is hypocoagulable. So stage 1 will be exact similar to जो हमने ऊपर लिखा था. Means आप देखोगे same thing, same as this, everything is same. Means RK is shortened, maximum amplitude is more, right? Angle is more. But later on अगर आप यहाँ देखोगे stage 2, in stage 2 when it's a hypocoagulable state, you can notice hypocoagulable means less clotting factor होंगे, तो R time क्या होगा, prolong होगा. So here you can notice R time is prolonged, increase in R, increase in K, R बढ़ गया, K बढ़ गया, and you can notice like अब angle और amplitude दोनों कैसे हो गए, कम हो गए, decrease in angle and decrease in maximum amplitude. So यही image based question exam में बार बार पूछते हैं. They will give you certain image and they'll ask you like what is this thromboelastogram is representing. So if you know all these components, so this is again you can notice here, यहाँ पर आप फिर से देख सकते हो. अब मैं आपको just short में बता रहा हूँ. You can notice here everything is normal. Here just अब आपको सब समझना है इसको. This is you can notice this is prolonged R, prolonged K. तो ऐसा कब होगा, जब क्लॉटिंग फैक्टर की डेफिशिएंसी होगी या फिर हेपारिन वारफारिन का ओवरडोज होगा. देन हियर यू कैन नोटिस K इज बिट प्रोलॉन्ग्ड, लेकिन MA कम हो गया, मैक्सिमल एम्पलीट्यूड कम हो गया. इसका मतलब प्लेटलेट्स आर नॉट सफिशिएंट. सो हाउ यू विल मैनेज दिस, यू विल गिव प्लेटलेट्स और डेस्मोप्रेसिन. हियर यू कैन सी LY30 की पूरी टेल बन रही है, मैक्सिमल एम्पलीट्यूड इज शॉर्टन, छोटा होता चले जा रहा है, कंटिन्यूसली डिक्रीजिंग. It is due to thrombolytic overdose. Focus on this thing. You can notice R is shortened, मैक्सिमल एम्पलीट्यूड तुरंत अचीव हो गया, बहुत ज़्यादा अचीव हो रहा है, दैट इज कॉल्ड हाइपरकोगुलेशन. सिमिलर टू दिस व्हाट वी सी इन DIC स्टेज 1 हाइपरकोगुलेबल. देन यू कैन नोटिस DIC स्टेज 2 में क्या हो गया, आर. यू कैन नोटिस अब क्या आ रहा है, आर इज प्रोलॉन्ग, इट मीन्स दिस इज hypocoagulable state, and MA is reduced. So these are the graphs that they ask in exam based on thromboelastogram. I hope you enjoyed the videos. So easy है, कोई डिफिकल्ट नहीं है, इजी क्वेश्चन, इससे क्वेश्चन गलत नहीं होगा. आप एक बार इस वीडियो को देख लोगे, यू विल नॉट मेक मिस्टेक. थैंक यू सो मच, कीप वर्किंग हार्ड, बाय बाय.